Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association, NALBA for short. Thank you for joining us today for our Plática on Tenemos Voz. It is We Have a Voice in English on Latino peer recovery. With me today is our esteemed co-host, Ana Chavez Mancia, NALBA's Program Director. She'll be introducing herself shortly. NALBA is a nonprofit agency that is dedicated to the well-being of Latinos and families and communities across the country. We're excited to be here today to share that our mission is to address the great disparities and barriers affecting the well-being and the behavioral health of Latinos. Today, we're excited to present our Pláticas series called Tenemos Voz on Latino peer recovery and the journey of hope and transformation. Plática is the Spanish word for conversation. So today, we're going to be having a conversation with our esteemed colleague, Dr. Haner Hernández, who we'll introduce in just a little bit. Today, I guess we get to highlight his incredible work, and more importantly, he'll be able to share his experiences and address the issues that are very compelling about why recovery is so important to the Latino community. NALBA would like to thank the New Mexico Human Services Department, Office of Peer Recovery and Engagement, for supporting these pláticas. They make it possible for us to be able to address the kinds of issues that relate to the recovery experience, of which we definitely want to promote and inform and educate the public about. So with that having been said, we also want to ensure that you know that today's presenter will be able to receive any of your questions or any comments that you might have, is he'll be sharing not just about his experiences and his insights, but we also want to know about the types of resources that are important for Latinos who are engaging in recovery or are in recovery and will stay in recovery. So with that, let's begin by asking our co-host, Ana Chavez Mancias, to introduce our presenter. And of course, she'll start with introducing herself. And then after that, I'll say a little bit about what you can expect as the live Facebook audience so that we can get you engaged with our incredible presenter today. So we're looking forward to you staying with us for the duration. And Ana, if you'll introduce yourself, that would be great.
Yeah, thank you, Fred. Good morning, good afternoon, everyone watching. My name is Ana Chavez Mancias, and I am the Program Director for the National Latino Behavioral Health Association, NALBA, for short. I am a person in long-term recovery. And that being said, I am super excited to introduce our presenter today. Dr. Hernández is Puerto Rican, bilingual, and has worked for over 35 years in the health and human services field, developing, implementing, and evaluating culturally and linguistically intelligent youth and adult health prevention, intervention, treatment, and recovery support programs. He's a master trainer and facilitator, and provides individualized technical assistance and support to organizations that provide substance use disorder and gambling prevention, intervention, treatment, and recovery support. Dr. Hernández has over 30 years of experience in delivering addiction counseling and clinical supervision to professionals in the field. Dr. Hernández is a person in long-term recovery with 36 plus years from addiction and is committed to eliminating health disparities by participating in the process that build equity. Welcome, Dr. Hernández.
Muchas gracias. Y gracias por la invitación. Thank you for the invitation and thank you for the introduction, Ana and Fred. Once again, thank you to you and your team at NABLA for the invitation and all of the work that you're doing on the ground.
Well, we get the good fortune of working with people like yourself, Anel. So if you're okay, I'm going to switch from that formal introduction, El Dr. Hernández, because I have such a strong affinity to you because of who you are, what you've done, and what you stand for. And we're honored to have you here today. It's just a real delight, compadre. And more importantly, is we're going to have a chance to really get to learn even more about you. So in fact, what I'd like to do is just have you say a little bit more about yourself, right? We read your bio, but if we read your bio, I could just imagine what your resume looks like and then what your curriculum vitae looks like. It's probably like 50 pages or something. But anyway, we're just going to have you tell us a little bit more about yourself. And then after that, Anna will take, and I will take turns asking you questions, Haner. So say a little bit more about yourself.
Yeah, so thank you for that once again. As was said earlier, yo soy puertorriqueño. I'm a Boricua who has grown up in the U.S. I am from Caguas, Puerto Rico, and I live in Massachusetts. I've lived here since 1968. So I have the good fortune of developing familia and comunidad here, as well as back in Puerto Rico. As was said, I've worked in the field of health and human services for the last 35 and a half years with a focus on eliminating disparities and building equity. That for me is central to my process and what I do. I come from a big family. At one point we were 10 brothers and sisters, right? And I credit my mom with bringing us from Puerto Rico as a single mother to establish La Familia Nuestra here in Massachusetts. And so I come from that sort of background of focusing on the collective, right? El colectivo de nuestra gente, the strengths that we bring. During my good fortune of living and working in the US, I've met people from all over the world, especially people from Latin America, right? Who have enriched my level of mental health, my level of practice. They have enriched my education, and I continue to be a lifelong learner. As was introduced earlier, I have a PhD, and I'm a certified prevention specialist, and I'm a certified and licensed addictions counselor. But I also have a GED, and my GED I got in prison, and it was more difficult to get a GED in prison than to get a PhD out here. Once again, I want to say this, I am a lifelong learner. I have a lot of credentials after my name, but I learned something from my dear mom early on. It is about how you treat people with dignity and respect, how you humanize people. And she was right, because most of the arrogant people that I've met in my life have all of the same credentials that I have after my name. And some of the most educated, sweet, loving people that I've met in my life are people who don't know how to read and write. And so that gives me perspective in terms of who I am as a human being, what I aspire to be, and what my responsibilities are as a productive member of my familia, first and foremost, as a person in long-term recovery living in the US, and promoting well-being, recovery supports, the multiple pathways of recovery for all of our people, not just for some, but for all of us. That's a little bit more about myself.
Thank
Well,
you.
all I could say is I appreciate you always reminding us that our abuelos or our padres are so significant to our life, that they actually help shape a lot of our values and beliefs, and it plays such a big role in our personal and then of course our professional life. So Haner, let's go over to Anna, because she's already got a list of questions for you, hombre. So we better make sure we go questions. So Anna.
Yeah, thank you, Fred. And thank you for sharing that with us, Dr. Hernandez. Can you, and I think you touched a little bit on this question, but if you can tell us a little bit more on how did you enter your recovery pathway?
Yeah, and so thank you for the question once again, Anna. I will say this, I have an extensive criminal record. The first time I was arrested, I was 11 years old. And I was gang affiliated, gang involved, and using substances. I went in and out of juvenile detention centers until I was 17, and then I went in and out of jails and prisons in the US. And at one point, when I was in my early 20s, I was sitting in a jail cell with $50,000 bail, about 12 criminal charges to my name. And the fact that it was $50,000 didn't matter, because if it was $5, I didn't have money to bail myself out, and my familia didn't have money either, right? So there I sat. And in the block where I was in the jail block that I was in, it was about 400 men who were sitting in that jail block. And through the grapevine, I heard someone told me, listen, if you say that you have a drug problem, they'll let you go to a drug treatment program. And that really caught my attention, not because I thought I had a problem with drugs, but because I wanted to get out of jail. And so the next time my lawyer was scheduled to see me, I said to him, listen, I have a drug problem. And he asked me a few questions, and then he said, well, I'm going to send someone over to speak with you. And a week later, someone came to see me. Her name was Margaret Gibbons, Sister Margaret Gibbons. She was a Catholic nun who chain smoked and knew a great deal about addiction and recovery and had a master's in social work. And she came to interview me, and I was looking forward to meeting her because I wanted to lie to her so that I can get out of jail. But today I understand that what she was doing was she was doing an assessment with the questions that she was asking me. And so I got to know her, and I said to her, listen, Sister Margaret, I want to go to this specific program in the city where I grew up, Springfield, Massachusetts. And she said to me, no, if you want to go to that program, you're on your own. I'll get up and I'll leave right now. I know of a program in Boston, though, that is a really good program. It's designed by and for Latino men who need, who are in recovery. And so that program is named Casa Don Pedro Albizu Campos. Don Pedro Albizu Campos was a Puerto Rican leader of the Nationalist Party in Puerto Rico who spoke 7 languages and graduated from Harvard. And so he was all about the independence of Puerto Rico. So you can imagine where my views come from as it relates to that. And so Sister Margaret said, on Thursday, I'm going to take you before the judge. And we're going to say to the judge that you have a problem with drugs, that you want to go to this program. The program has accepted you, and see what happens, right? And so there I was with Sister Margaret and my lawyer. We went before the judge, and the judge said, absolutely no, we can't send this guy to this program. He is a danger to society. He is problematic for many different reasons. And the DA said, look at his criminal offender record and look at what he's done. We cannot afford to send him there because he is not going to be productive. And so they sent me back to the block, to the jail. And there I sat, and that was Thursday. And so I said to myself, well, I took a chance. They might have sent me, but they didn't. So I got back to the block, and there I was for a few days. And on Sundays, in the jail that I was in, they don't release people on Sundays. So I was sitting in my cell, not sitting, but laying back in my cell, watching some TV. And this CO, corrections officer, came to my cell and said, pack it up, you're going home. And I just laughed. I said, I'm not going anywhere. It's Sunday and I'm not paying attention to you. And so the word got around in the block that I was leaving, and everyone believed it except me. And so the other inmates, most of them that I knew, came to my jail cell to ask me for stuff. The tradition is you're going home, you have to give away your TV, your cigarettes, your clothing, your commissary to other people who are staying behind, right? So I wasn't having it. And the guy showed up, I need this, I want that. I said, I'm not going anywhere. And then a few minutes later, the white shirt, the captain showed up at my cell and said, Hernandez, pack it up, you're going.
Oh, wow.
And so there, I said, yeah, this is happening. This is happening. So I gave away all my stuff, and they took me down through the intake, and there was Sister Margaret. She was waiting for me, and she put me in her car and drove me for 2 hours all the way to Boston. And we talked about family, we talked about addiction, we talked about drugs. All the while in my head, I was saying, I don't have a problem with drugs. The problem that I have is that I got caught. That's the problem that I had, not the problem that I then came to believe that I have. And so I showed up at Casa Don Pedro Albizu Campos with Margaret Gibbons, who brought me there, and they received me there. And I was there against my will. I didn't want to be there. And yet there I was with people who understood what I was going through, who understood addiction, who understood recovery. And what they wanted from me was to humanize me, to help me regain my humanity, to help me to see what is possible as it relates to recovery. So that's how I got into treatment. And that was a TC, a therapeutic community, that at that point in time, those treatment programs were 18 months to 2.5 years. You can imagine what I was going through.
Yeah, wow. Hearing you talk about that, I mean, it reminds me of when I went to treatment, you know, that thought that you have, like, oh, I'm just gonna go there, and when I get out, I'm gonna go back and do my thing because I don't have a problem, right? So wow, incredible story. Thank you for sharing that with us. That's amazing, amazing, an amazing path that you took, and now here you are, over 30 years later. You know, so thank you.
Yeah, well, thank you. I'll say this, right? So I was there not thinking that I had a problem, but these men, these Latino men were really bright. They knew, you know, people who are in pre-contemplation. They knew people who are in contemplation. They knew people who are ready for some action. But there I was in pre-contemplation. But they knew the stage of change that I was in, and they educated me around how I continue to end up in those situations. And so for me, it was easy or easier to say, I'm never going to do heroin and cocaine again. But internal voice, I said, I'm going to smoke weed and drink beer because I don't see how you can be productive without doing that, right? Again, internal voice, but they knew what was happening with me internally. So they did more education. And I went from pre-contemplation to contemplation to preparation to action. And so I embraced this whole idea of I can't do alcohol and weed because that leads me to cocaine, it leads me to heroin, and that leads me to prison, and I never want to go back to prison. Those were the things that were going on in my head. But this is how this disease works, right? I'll say this. I said, but I've never worked a day in my life in the legal economy. I'm going to sell drugs when I get out of here. Internal voice, right? But they knew, somehow they read my mind, right? Or I thought they did, but they just had experience and expertise. And so, you know, they did more education with me. And eventually, as I grew through the stages in the program, they said, we have a job that we think that you will be good at. And I looked at them like they were crazy because they were offering me a position as an outreach worker. And I did not know what outreach was, but I was interested in helping other people, right? That's my sort of journey into this field and my transformation based on that loving, humanizing support that I received from those men in Boston.
Wow.
Amazing. Well, you know, we want to say a little prayer for Sister Margaret then, because here's what she did that's really phenomenal. It's that, well, it's what we're looking for as Latinos, right? Not just recovery, but what she was very astute to know is to say, well, here's a recovery program for Latinos, about Latinos, that involves Latinos because of the intimate knowledge about how we think, right? And because one is the recovery aspects are so critical, but when you have your cohorts of Latinos doing this to support you, what a great story, right? Because of course, I'll never forget that you're lying to the sister, right? And lying in the way that, you know, we think as Catholics often, right? That, well, it wasn't really much of a lie anyway. It was just a little lie. And it was because I was trying to do something good for myself. And we justify our thinking in a lot of ways. But thank you for sharing that. And in fact, just kind of, if I can take an extended view of what you just described, this next question, I think, helps us kind of look at this entire dynamic because of the work you have done at the local level and then regional and then national. It really speaks to what's important about this next question. And so, Adele, we'd like to ask you, what do you think are the challenges for the Hispanic/Latino community as it relates to these different multiple pathways of recovery and how one can sustain that recovery? Because it looks different for every person. But what's unique is you've seen many people enter into recovery,
Mhm.
and that's a success. We want to highlight that because in part, when you work in that arena and that sphere, you bear witness to it
Mhm.
because you are the person helping that person, or you work in agencies or train groups to know what approaches work effective with Latinos. So we'd like you to share a little bit about what that looks like. So please go ahead.
Well, thank you for that, and the opportunity to share about that. And by the way, Sister Margaret knew that I was lying. She just didn't confront me about it because she knew that that's a part of the process, right? And later, we laughed about it, and she said, "Yeah, I knew this and I knew that, but I our role is not to judge. Our role is not to beat people up. Our role is to be supportive and to be understanding." And so she taught me a great deal about what that means, right? Because many times we get so frustrated with people within our familias, within our communities, that are struggling with getting into recovery or stop using, that our emotions get the better of us and we treat people badly. And that is connected to many different things, right? So coming back to the question very specifically in terms of challenges for Latinos, and I would say that this is true for other people of color, Native American people, as well as African American, Black people, primarily in this country. We know it's been documented in the literature, and it's been documented through the histories of thousands of people across the country, millions of people across the country, that we have a public health challenge that has been dealt with by way of a criminal justice lens, right? And so that is a huge challenge because many of our folk, no one, first and foremost, no one grew up and said, you know what I want to be when I get older? I want to use drugs. I want to inject myself in my neck with heroin and cocaine. I want to smoke crack. No one grows up believing that, right? Yet we end up in those situations for many different reasons. And trauma is connected to that. And generational trauma is connected to that by way of challenges. And when we think about the diversity of the Latino, Latinx, Latina community in the US, we are very diverse people with a lot of strengths, as you point out, right? Because this is not about only thinking about challenges. We bring a lot of strength to these issue areas. Yet, we have had a criminal justice approach to a public health problem. And many of our folk, even in this age where we're being a little bit more humanizing around issues of substance use and mental health challenges, many of our folk are still primarily engaged in a criminal justice system that doesn't respond to our needs very well. This is the only disease in this country that we send people to jail for, right? Upwards of 65% of people have a mental health challenge. Upwards of 80% of people who are incarcerated have a diagnosable substance use disorder, and I was one of those people, right? So when we talk about challenges, we talk about a public health system that by and large hasn't been designed to meet the needs of our people. And that is a huge challenge in front of us, right? And in these days that we're talking about equity and the need to lead with eliminating disparities, there are huge disparities with our folk. And in part, when we talk about challenges as it relates to substance use disorders and gaining pathways into recovery, the system has been really punitive. We have said to people, if you want to change, listen to this language, if you want to change, you need to stop being in denial. You need to hit rock bottom. And you need to be more like Haner or Anna or these other folk who have done it, because if they did it, you can do it too. That sounds good, but that's really individual and punitive. The reality is that there are systems that are set up, and those systems have policies and procedures. And those policies and procedures many times are designed to allow some people to get in and some people to be kept out. So think about access, right? But don't just think about access. We need to think about quality of care. So if I am ready to go into a treatment facility and there is no treatment facility that understands my language, my culture, you can't blame me for that. We need to then analyze what's wrong with the system, right? And many times, services are designed to be punitive. Take, for example, for years in our field, when people enter into treatment, and this still happens to this day, when someone has a reoccurrence or a return to use or a return of symptoms as it relates to substance use disorders and mental health, we have kicked people out of care, for those very reasons. That is a very punitive approach, because the organizations who have taken public dollars to provide services to people said in their fancy proposal that they understand how to treat substance use disorders. Yet we kick people out of care for exhibiting the same signs and symptoms that these organizations said that they understood how to deal with people, right? And so this requires a revisioning of how we do things and how we think about things. The other thing is that we talk about the continuum of care. And here's the way that we talk about it by and large: prevention, intervention, treatment, and treatment and recovery supports. That's how we talk about those of us who have been working in the field for a long time. We're talking about the continuum of care as this: prevention, intervention, the multiple pathways of recovery, which include treatment, and then recovery supports. Why the emphasis on the multiple pathways of recovery? Why? Because of all people who need help with a substance use disorder, only 25% need treatment. The other 75% get better utilizing other pathways. And so we need to emphasize and understand what the other pathways are so that we can better support people in accessing and sustaining recovery through those other pathways, right? They include things like 12-step fellowships. Do they work? Of course they work. Are they for everybody? No. Medication-assisted treatment, medication-assisted recovery, does that work? Of course it does. Is it for everybody? No. Faith-based processes, right? Faith-based processes, do those work? Of course they do. Are they for everybody? No. You hear my mantra. Are they for everybody? No, right? Rational recovery, smart recovery, celebrate recovery, refuge recovery, do those things work? Of course they work. There's a number of pathways that work. But here's what we do. We tell people, here's what's wrong with you. Here's what you do. Here's how you do it. And then when it doesn't work, it's your fault. And we need to be about putting options in front of people, viable options that are aligned with their cultural, spiritual beliefs, right? And then have people choose what works best for them, as opposed to what works best for me, because my pathway is only that, my pathway of recovery. I cannot be imposing my pathway on other people, because then if it doesn't work, what happens with folk? They end up back out using on the street, and many of our folk are dying left and right, not just from opioid overdoses, but because of all of the conditions that exist in our communities. So it's a complex question for me, but it's not that complex by way of understanding it, because we have experience in terms of what works. And it's not just one thing that works, it's multiple things. And the collaboration between all of us doing this work with people who need to be humanized is where it's at. And we need to move away from these punitive approaches, including mass incarceration, which is at the tip of how we deal with people with substance use and mental health disorders in the country. We have the largest prison population per capita in the world.
Mhm.
Yeah, well said. I think your analysis of this is, based on not just, what your own experiences were, but also recognizing that wait a minute, right? What about the system, right? Making sure we take a look at whether that system is responsive, appropriate, and is it acceptable to us? And you described just exactly really what the challenges are. It's oftentimes not just the person, it's really sometimes in large part because of the way these systems are set up. And I think your mantra was spot on, right? Because it's really talking about something that, we tend to lose sight of, right? And that is the fact that recovery is something we want to celebrate. We want to see more people in recovery, and how they get there is what's important, right?
Mhm.
Because that teaches us, the system, the providers, how do we adjust what we do to really reflect that? I appreciate that comment about the system, because there are some states whose laws that are applied at the local level put people in institutional facilities like detention facilities and jails
Mhm.
who haven't committed a crime
Mhm.
because of their addiction or mental health condition. So imagine that, right? Is that we're putting people in those jail settings because we don't have a treatment system or an intervention system designed in this country that is adequate or sufficient. So thank you, Haner, for that. And I know Anna's chomping at the bit for the next question. So we're going to go over to her and have her go to the next question. So go ahead, Anna.
Anna, before you go, I just want to highlight this piece. There's 23 million people who identify as being in recovery in the US. That is 23 million people. That is 23 million families. That is countless communities across the country. And we didn't all do it in the same way. And that's the beauty of diversity. That is the beauty of how we do things, right? And we know that the opposite of addiction is connection, right? We know that recovery is all about connection with many different people. So I wanted to highlight that piece of data because you're right, Fred. We are also talking about evidence and outcomes and what's in the literature, what we've learned there. I just don't talk about my personal experience. I pepper the story with my lived experience because I think it helps other people to connect. But there's some people who want to hear what the evidence says, what the data says, right? And so we're highlighting that as we go along as well.
Yeah, thank you for that, Dr. Hernandez. Yeah, and 23 million people, that's a large majority of our population here. And also, going back to those incarcerated, right? Almost 2 million people in our jails today, and 75% of those do meet criteria for substance use disorder, right?
Mm-hmm.
Out here in California, the Department of Corrections is the biggest mental health provider in the state, right? So, and that's a problem. That is definitely a problem. So let me ask you this next question, which I think it kind of it's your response to our previous question kind of gateways to this one. What are some of the strengths of our communities in relation to SUDs and mental health?
Thank you for couching it in being strength-based, because again, I talked about how punitive we are when we see things. And when we go to talking about barriers, we say, oh, the language is a barrier. My language is not a barrier. My language, our language is plural, are fortalezas, they are strengths, right? And so when we talk about strengths within our communities, we must begin with our cultura, right? Plural, not singular, because we travel through many different cultures, and there are many different cultural aspects that are based in resiliency and in strength. And so for me, familismo, the fact that we are organized, the Latino community is organized around the collective, is a huge strength, right? Because we think about not just ourselves in an individualistic way, we think about la familia completa, the family unit, right? This idea of personalismo is a really important cultural element that is a strength within our communities. You know this, I know this, we all know this. When we get together, we don't get to business right away. ¿Cómo tú estás? How are you? How are the kids? How's the dog? How's the family? How's the weather? How is it? We do that personal connection thing, right? Before we get to that. And for our non-Latino friends who are listening in, think about how you engage in personalismo, because you don't have to be Latino, Latinx, or Latina or Hispanic to engage in informal conversations with people that develop trust and respect. Those are strengths within our cultura, right? Also, our ideas of how we relate to one another and our responsibility to the collective, to the collective. Familismo, coming back to that concept, right, is this idea that our family is extended, right? It's not just, mom, dad, kids, 2.3 kids and a dog or a cat. We include comadres, compadres, primo hermano, right? Cousins, friends who are now family, right? Who are not blood relatives. And those are strengths within our communities, our ability to understand different cultures, to travel from one culture to the next, the strength of traveling. If families have, the families who have immigrated here to the US, right? The strength that it took that family, that individual, or that collective of people to pick up and leave cultura behind, to leave your country, to leave what you know, to travel distances, to come here and experience trauma, racism, and other forms of oppression. From that, we have gained a lot of strength and knowledge, right? So we have a lot of strength, even when I think about the people that I work with, right? My people, nuestra gente. We can look at them in one of two ways, particularly people who have mental health and or substance use disorders. We can look at them in two ways. We can say, number one, they're broken, they need our help, and I'm here to save their lives, which is a really top-down, view of people, right? Or we can look at them as people who are resourceful, resilient, who have survived years in prison, years in solitary confinement, years living on the street, years being treated badly. And so they have developed strength and resiliency. They have survived oppressive settings where some of us wouldn't even survive one day. And so do we look at people as broken, or do we look at people for what they are, with a lot of strength and a lot of resiliency? Yes, they have challenges, but that's what we're here to do, to humanize people, to help them understand what those challenges are, and to provide strength and hope. Because when people see folks like you and me and countless others, again, of those 23 million people, there are millions of us in this country who have gained access to recovery and recovery supports. And we're committed to humanizing and working with other folks. And that sense of the collective is a huge, huge strength that we have, right? Que yo puedo cambiar del inglés al español así, and that my brother and sister who are Brasileños can change from English to Portuguese to Spanish with a quickness, that we can translate on the dime, that we can navigate systems that haven't been designed for us, but we can navigate and advocate to change those systems. Those are all strengths that we have. And I didn't know any of this because I went from prison to treatment and I had never worked a day in my life. And if I have been able to gain the level of knowledge, access, and resources that I have, we can help other people not just meet, but succeed and excel and gain even more strength than the strength that I have, right? Because I am only as strong as my collective, mi colectivo, right? The people who are around me. So when I think about strength, I get really excited about it, because I don't view our people with a deficiency lens. I view our people with a strength-based lens, and I practice as much as I can with that strength-based lens. And then I have people around me who can guide me, support me, and also speak truth to power when I'm off the rails a little bit. So wait a minute, Hannah, you need to take a look at this. You need to think about that, right? So we need to also remain teachable, so that when we engage with people, we are doing it in a way that is progressive, that is forward thinking, that doesn't fall into the space of I know it all, because that is detrimental thinking to our process of recovery and to our process of elevating other people up. So those are some of the things that I think about when I think about resiliency and strength, right? El poder, el conocimiento de la mujer latina, right? The power and strength of Latina women. I mean, the stuff that Latina women do is like, oh, we want equality. I can never be equal to a female because they do things that I can never do. You see, they know things that I can never do. I need to celebrate and understand what that means, right?
Mm-hmm.
When we say youth are the future, no, they're not. They're the present. They're here now,
Mm-hmm.
right? They're going to be around longer than I am, for sure, right? But why should I think about them as something that's going to happen later on, when they're experiencing all of this stuff now? And they have a lot of knowledge. The stuff that they do to connect with each other around technology, we didn't grow up with that. They have strengths that we can never imagine to have, right? And so it's a matter of looking for strengths as opposed to looking for broken people and broken communities. Our communities have strength, and they're grounded in our people and in our cultura.
Absolutely. It's almost like we have to, we should be developing their leadership skills, right?
Mhm.
Rather than looking at, you need help, you're broken. Like you're saying, coming from this view of, hey, you are, you're a leader and you have all these skills, you're resilient, and we need to develop those skills, and focus on the strengths and the positives rather than on the brokenness. But yeah, wow, thank you for that. Fred, I think you wanted to say something.
Well, yeah, I mean, what a great way of describing, uh, you know, the frailties of the system. But what's good about the systems is this: is they do have something, if it were optimized, that could be of benefit, and that is quality and performance improvement systems are built into them. But oftentimes the question is, what kind of information goes in? Because whatever goes in comes out. But what happens is if there's information missing, then the question is, what is being done with that data? So here's something very significant. I love the way, Haned, you were talking about kind of re-envisioning the system, right? So I'm going to kind of follow you in that pathway a little bit, because I'm going to ask you to kind of bring to bear, how you envision the system, right? In light of something that is very significant to this country. And it's actually one of the greatest disparities that exist. It is a crisis that is impacting the Latino community, and the policies and the programs and the practices to address it are not anywhere significant enough. And so I want you to speak to this particular issue and then envision how we can address it. So 1 in 10 Latinos over the age of 12 have access to substance abuse services. Only 1 in 10 in the United States. I can't help but want to repeat that because it's very telling. So the science has done a great job of finding the data, reporting it, and sharing it. And then the system is here, and how do Latinos access it? If only 1 in 10 have access to it, as you said, what does the system need to do differently to be able to ensure that the Latinos can benefit from the public resources that have been invested to ensure better outcomes? Because it's one thing to wish better outcomes, it's the other to achieve them. Because every Latino I've worked with in my entire career seeks to have something happen that's better for them, because it takes a toll to have to deal with addictions, mental health disorders, conditions that are oftentimes out of your control. So walk me through how to envision how we can help Latinos in this country, given the significant data that presents itself today and is impacting our community. So kind of walk us through that little journey, and I'd love to hear your response on it.
Well,
Thank
thank you for that. I'll say the following. I'm a public health person, so I believe in multiple strategies over multiple domains, because I don't think that there's only one thing. Like I talk about multiple pathways of recovery. In order to deal with the myriad of challenges that we have, we need to have multiple strategies over multiple domains. So when we think about the behavioral health workforce as an example, right? The folks who work in behavioral health, what does that workforce look like? Well, it's primarily female, documented, primarily white, primarily baby boomers. The people in need of services are younger and more diverse. So there's a lot of work to be done by way of systems and policies as it relates to that workforce. How do we attract those young people into the workforce? How do we train them? How do we provide supervision, support, and the proper support so that they can have success within the field? That requires that organizations who say, by and large, that they can't find us, I don't know where they're looking, right? Because I can throw a rock right now and find a whole bunch of us, right? And I won't throw a rock because I'll hit my own people, but you get what I'm saying, right? They need to take a step back and ask themselves, how is your system built that you say you cannot find people who are the largest minority subgroup in the country, right? It's impossible. We speak this, the Spanish is the second most spoken language in the world, right? And so you need to look inward and ask yourself, how is your organization structured that you can't find them? And then when you can find them, you can't retain them. And so if we're honest, we need to look inward, right? Into organizations, beginning with who's on your board of directors, who is in senior management, executive leadership, who is in middle management, who's in the front line, and then who cleans your bathrooms, your toilets, and picks up the trash. And when we do an honest assessment of most organizations in the country, they are diverse in terms of a little bit in terms of who's in the front line and who's picking up the garbage and cleaning the bathrooms. But in upper, right, management, in boards of directors, you don't see that level of diversity. You want to change, it begins from way up there, right? It begins from who is represented, those sorts of things. And then when we think about what it takes to get into this field, right now, young people are leaving colleges and universities with $100,000, $200,000 worth of debt, right? To then end up in a job that doesn't pay well, that doesn't have really good benefits, and doesn't have really good support. So it doesn't surprise me that a lot of people don't want to come into our field. So we need to take a look at how these things are done by way of workforce, right? In terms of organizations, right? Very specifically, I'm going to come back to this idea of assessment and self-assessments. We who work in substance use and mental health, we are really keen on telling people at the individual level, oh, you need to look inward and you need to do, an inventory and you need to figure out, how you're going to get better. And you need to stop being in the organizations need to look inward again at all levels. We have shifted a little bit in the country. We're not quite there yet, but there's a shift with thinking about the elimination of disparities and building equity. There's a whole conversation going on. There's a lot of really good work that's happening on the ground. There are funders from the federal level, from state level, from private foundations who are shifting the way that they think about this. And that is a huge shift in systems. Are we there yet? No, we're not. But there's a shift. And we'll take that because that strength, that is a little bit of progress. Funders need to fund organizations and hold them accountable to outcomes that are designed to eliminate disparities and build equity. And you can build that into how you put out funds, who applies for them, how you, right, funders, how do you award grants, to whom do you award them to, and then how do you work with organizations and communities to uphold those values and those strengths that are talked about in many of the different meetings. How do we operationalize that, right? From the funder's perspective, because there's a role there. All of us have a responsibility to hold elected officials accountable for their actions. All of us. And here I want to emphasize those of us in the Latino community, we have a responsibility to do that. Because many times people who are making laws are not responsive to our needs. And so if we're going to talk about systems change, we need to talk about the politics of that as well. And some people say, that's politics, I don't get involved in that. Well, I refuse to bury my head in the sand, because the reality is that there's a system that operates here, and things happen for a reason, or they don't happen for a number of reasons. So it is at the federal level, at the state level, at the local level, by way of policies, procedures, politics, grant making, who gets funded, all of that. It is by way of organizations to look inward, who's in senior management, who's on your board, who's on your staff, frontline staff, who is, right? It's to reform all of that. It behooves the country to shift the focus from a criminal justice approach to a public health approach, to a true public health approach. It's not only that we have 2.3 million people, the largest prison population per capita in the world. It is the fact that we release 7 million people a year from county jails and about 600,000 from federal and state prisons. And again, those numbers do not lie. About 75% of those people will be rearrested within 6 months. And so we have this revolving door that is inhumane, that other countries have said it's inhumane, that other countries like Portugal have done something radically different, and we see the outcomes there. So we have to learn from other spaces and places as well. And now I want to come to the individual level, right? To the individual level. Those of you who are in the audience who are thinking about what can you do? What can we do at the individual level? Well, my mom me decía, you point the finger a lot that way, there's 3 fingers pointing back at you. You need to look inward and see what you need to change, Haner, because there's a lot that you can do and change from yourself that's going to help other people. And so there are individual self-assessments that all of us can take. I do at least once a year, I do one. If you want to see the implicit bias one from Harvard, it's online. Implicit bias assessment by Harvard, go online, Google that, you'll get it right away. Or visit the National Center for Cultural Competency out of Georgetown University. They have a number of self-assessment tools at the individual level and for organizational level. How is it that I assess myself? If I'm going to rely on people say, oh, Haner, you're a really nice person. I really like you and you do really good work. That's one thing that just tells me that. But when I do a self-assessment, it tells me what I do well and what I can improve. And then I can go about doing transformational change in terms of practice. So if you notice, for me, it's not just one thing. Again, I want to end up where I started. Multiple strategies over multiple domains. At the individual level, at the policy level, at the grant-making level, federal, state, local, private foundations, at the organizational level, it is all of those things working together in some type of harmony that is going to help us continue to right this ship, right? Continue to right the ship. And it is a huge ship. It doesn't happen overnight. Let us not forget that disparities have been developing on this continent for hundreds of years, And we're not going to eliminate them overnight. But it doesn't mean that we don't work hard to eliminate them, not to reduce them, to eliminate them. And we do that by leading with equity, not equality, because equality only exists in the minds of people with power and privilege. Those are the people who say, if I did it, anyone can do it. Well, I'm going to go back to myself. I have a PhD. And do I believe that other people can get a PhD? Of course, because I know a lot of bright people who can get a PhD, but the system is set up in a way that they're not going to, because it is set up in a way that they're going to have challenges. And some people are going to be left out, and some people are going to be kicked out, and some people are going to be pushed out. It is our responsibility to bring attention to the systems approach of what we're talking about.
Awesome, amazing. Well, you gave us a recipe, right? So I hope folks are making note of the recipe about how do we operationalize these changes, right? And I think you laid out very clearly ways to do that and that are effective, because what happens is that changing nothing at all ensures the outcomes that we now have. Making the changes to improve the lot and the health of others means that we are now going to learn from the lessons of the past, because this is the era of equity. I think we need to be able to frame that the bigger picture is the era of equity that we're in, which is great to see, because it's absolutely much different than what I've certainly, and you, Haner, have seen, and Anna, in our lifetimes. But I want to just do a couple of things here before we go to our final question that Anna is going to have you respond to, Annette. And somebody, by the way, named Dr. Jesse Roque Romero sends you some saludos. So we know our mutual colleague, and so he took time to join us today. So te manda saludos. And
ese es mi hermano, Rocky. Saludo, hermanito. Pa'lante siempre.
Yeah, son hermanos, Oh, maybe you might become primo hermanos eventually. So whatever that means, have a stronger bond. But I want to share with you that Elizabeth Perez has something she wanted you to know. She said, absolutely, the organizations that lack in their search for qualified mental health clinicians, particularly people of color, right? but also the failure to appreciate our culture and personalities because of our culture really simply means that sometimes there's the issue of racism still continuing to happen. So they send you their thanks, and more importantly, we're gonna now kind of come to the final question for today's show, and we're gonna have Ana kind of close us up with the final question, and then we'll say our despedida. So I'm gonna go ahead and turn this on over to Ana to wrap us up, and only to say we plan to bring you back on air. We've had so many people come in today to this live Facebook Plática. Before we leave, I want folks to say anything else in terms of questions or comments, because this will stay inside of our live Facebook page moving forward. So Ana, over to you. Gracias.
Thank you, Fred. So our final question for today, and that's just because the hour was just not long enough. It's just not enough to talk with you, Dr. Hernandez, but what do you want today's live Facebook audience to take away from today's Plática?
So thank you for that. And thank you for all the comments there, Elizabeth. I appreciate your comment as well. I want to say something before I answer that question, and I'll say it briefly. There are countless people like me, like us, who want to be a part of the solution. Your organization can do a great deal to bring us in because we have passion, we have knowledge, we have a commitment to being a part of the solution. If there's something that I want to highlight before we end is the following. For those families out there who are struggling with a loved one who is still struggling with active substance use or a mental health challenge, you're not alone. Reach out to us. You're not alone. No están solo, no tan sola. Right? We know how to work with folk, and you're not alone. Please reach out. To everyone else, I want to say, our folks have been dehumanized. They've been treated in a way that is dehumanizing, and we need to humanize people. We need to, again, lead with strengths. We need to reach out to people who have been marginalized, people who have been racialized. And we need to lead with strength, with understanding that those folks are part of our communities, part of our lives, that we have a responsibility to bring them in. And for me, that is a lifelong commitment to this process. And so to the folks who are out there, like mi hermano Rocky and others who work every day to humanize and to help others, I want to thank you. I want to thank you for all the work that you do on the ground, all of the work that you do. And there is no problem. And I want to say this to some folks who have made mistakes in the past. I've made my share of mistakes, and I'm sure that I'll make some more in the future. But the reality is this: if we are engaged and honest with each other, then we can surpass those mistakes and learn from them and build the communities that we all deserve, right? We need to ground all of this work in an understanding that there is cultura de por medio, there's culture that's happening, and that we build community by building, respecting, and honoring culture, and honoring each other, and honoring, as Fred said, our ancestors. I am not here sharing new information. I am sharing information that was shared with me by a lot of people in my life and in my community. So with that, I want to say thank you one more time for the invite to participate. I know that time flies, right, when we're impassioned with these conversations. But Ana, thank you a great deal. Fred, to you, the team at NABLA, and to everyone who joined today, thank you very much for your support and understanding.
Well, like Ana says, an hour is not enough time, but all I can say for folks who spent their lunch hour with us, talk about getting an hour of dessert. Porque sabes que we love this stuff, we eat it up. And the reason we do is because, as you said, somos personas de poder. So we're going to have you come back, Dr. Haner Hernández. Thank you for being with us today. I want to acknowledge my colleague, Lawrence Medina, who also joined us, and he sends his thanks to you. And for all of you on Facebook today, thank you for joining us. We will record this as session. It'll be back on Facebook, and we're going to continue to play this. So please have exchanges with Dr. Hernandez post this session, and we'll include contact information so that we can keep this dialogue going, porque no se para el trabajo, no? With that, I want to say thank you to my esteemed colleague, Ana Chavez Mancias, who did a phenomenal job. All I can say, I think she may be the new Joan Rivers of Facebook, porque she has great passion. She has such great humor, but she loves what she does. And I want to acknowledge all that she's done to be here and to have invited you, Dr. Hernández. So we look forward to seeing all of you some other time. So for now, the despedida is ahí nos vemos. So thank you all very much, and we'll see you soon.